Welcome back. This segment is sponsored by iChiro Peak Performance Chiropractic. It is time for some chiropractic myth busting today. Dr. Mike Kwast is here to talk about some chiropractic care and arthritis in particular. One of the biggest myths out there that I think everything's like, oh no, arthritis is just for people of a certain advanced age. It's like, I know I for one break that. I have all kinds of arthritis going on in this knee. I've had all kinds of ACL replacements and all that good stuff. So it can really start at different ages, right?
Yeah, not only that, you know, it's a common misconception, osteoarthritis, degenerative joint disease. People just think they're doomed to have it because of what we call age.
Sportsy here, yeah, too.
You know, and it's an old person's thing.
Right, right.
And really, if arthritis was from age, then you would see people's joints worn out exactly the same because all your joints are the same age.
Ah, that makes sense. Okay.
I had a guy come in one time, an older guy, and he had a hip problem, and he wanted an opinion about it. And I asked him, I said, what's going on with your hip? And he said, well, I've been to the doctor, and they say it's worn out. And I said, well, why? And he said, because I'm old. and I said, well, how's your other hip? And he said, well, there's nothing wrong with that hip. It's fine. And
right.
I said, well, how old's that one? Yeah.
Is that a younger hip than the first one? Yeah.
So this perception is really just wrong. And, you know, obviously people want to use that because you can't control age, right?
Right, right. We blame a lot of things on age. We just like to throw that out there, yeah.
Yeah. Really where you see this degeneration occur is from injuries to the muscles and around the joint. So you'll have trauma to the muscles. Typically when it's in the spine, it's the deep, tiny stabilizer muscles.
Okay.
And what happens is you have, you know, if my hand here was the bone, you have a bone and you have another bone, that forms the joint. And then inside the joint is cartilage.
Right, all that good stuff.
Yeah, so we'll just pretend this is like your cartilage. And then you have these little muscles that go from one bone to the other. And what happens is when you fall down or you slip or you have an injury, even if it's minor, that little muscle in there will actually get hurt and it will spasm and contract down. As it spasms and contracts down, it will squeeze this joint together, which then will compress the cartilage in there and put that under a compressive force, which causes that to then wear over time. Now the problem is this doesn't hurt until the majority of the cartilage is gone. Then you get bone on bone and it hurts really bad.
Painful.
That's typically when people will run for help because that's when it's symptomatic. The problem is there's not a whole lot you can do when it's already all ruined, right? So the better approach is to find where those muscles are compressing that down early when the cartilage is still healthy in there, and then get those muscles to stop compressing. And that's where the chiropractic role comes in by doing adjustments to those joints. The adjustment causes the muscle to relax, which then opens the joint, which then preserves the cartilage.
So then you don't have the bone that's pushing down anymore that's going to take away the rest of the cartilage that might be left in there.
Yeah, exactly. And you know, this is, you know, my opinion of how this works, and from a common sense standpoint, you know, if we were to take you and have two of you, and one of you we worked on regularly and decompressed those joints, and the other one said, I'm not doing any of that, I'll just take Tylenol every day. And then we looked at you when you're 65 and we compared the two. Which one is going to have a better function and which one's going to have more of this stuff left? And so that's really one of the secrets and one of the keys that, you know, people just don't know because everyone's waiting until they hurt. Yes. Which then it's not a lot of options.
And you've told us before, like, don't wait until it hurts so much. Like, go when you have little things. Your body's telling you all these little things, get in there early because there are things that can be done.
Yeah, and this is no drastic idea. I mean, everyone already does this with their teeth. You already do that with mammograms, pap smears, breast exams, colonoscopies. All these tests we do have nothing to do with your feelings. They all have to do with how your body functions. And so we have tests too, the different motions, range of motion, that'll tell you where that compression in here is. And once we see where that is, then you just decompress it. And that's a positive thing you can do.
Preserve it for a little bit.
Yeah, it just makes you last longer, which most people are interested in lasting as long as they can.
I would like to last longer. I would like my bits and pieces to last longer. Well, you can find more information online. iChiro Peak Performance Chiropractic has 2 Grand Rapids locations, one on the East Beltline and then one on Kalamazoo. We've also put this information and its tips on our website, WZZM13.com. Just click on our Take 5 homepage.